Okay, got about 5 more minutes. 5 more minutes.
I have a question.
Sure.
You know when you pull a muscle,
Yes.
is that like how different is that from like spraining something?
That is a really good question. What do you think?
Isn't like a sprain when it like tears?
That is also another thing. Yeah. So you could strain your muscle, you could tear your muscle. Yeah.
Isn't spraining the ligaments and not the muscle?
We'll talk about that today, but the short answer is that when you sprain like your ankle or something, it stretches a tendon. Usually not the ligament. If you're stretching ligaments, that's really bad, but usually it's the tendon, and that's why it's sore and a little bit of bruising.
Something from like hitting it too hard.
Yep.
How does that happen?
Same thing when you hit it, like sprain your finger, right? In basketball. When you hit this, it puts pressure on all these ligaments and bones, and so that's what swells up.
I hit my finger on the table once, and I sprained my pinky.
Yeah.
I also had one of those
I mean, same thing. Like when you get a Charlie horse, right? Somebody knees you in the thigh, right? It hurts because when you impact that, you're pressing on the bones and muscles.
Why does it hurt so much to stub your toes?
Same thing. There's bones and muscles there that have nerves.
Specifically your toes. I feel like when you stub your finger, it's not as bad as when you stub your toe.
Really? Well, I guess when you stub your toe, right, you have your whole body weight. Right. When you sprain your finger, it's not that much weight. Yeah. So that's a really good question, though.
I stubbed my toe on a 20-pound dumbbell so many times. Once I stubbed it so bad, I legit thought I broke my toe.
Yeah, that's not good.
It hurt all day, and then the next day it was completely fine. It was weird.
Nice. Yeah, all of the injuries.
Yeah, but I've sprained a ton of things, but I've never broken anything, which I think is surprising. I don't go outside that often either, so.
But you play, what sport do you play?
I used to do gymnastics.
Oh yeah.
I'm surprised I never broke it.
Yeah, you can get hurt in gymnastics pretty easily.
Tons of sprains, but never broke it.
Yeah.
What would you want to is that older better? What would you rate it now? Yeah.
Okay, guys, about a couple more minutes. Okay, a couple more minutes. Start.
7.5.
Subject.
What hurts more, breaking a bone or tearing a tendon?
Okay, well, there's different kinds of tears, right? If you completely tear your tendon, it's pretty sore. I would argue that breaking your bone is still more sore, but Like when you tear your Achilles tendon, right? Have you ever had a friend who's done that? It's pretty painful, right, for that person. But bone is like, yeah, it's pretty bad. Yeah. Have you seen anybody break a bone before?
What does it hurt?
Which bone did they break? Going to the finger bones. What, like their forearm or upper arm, or and what happened to them?
They fell down the stairs.
No.
They fell down the stairs and they braced themselves. And was it poking out?
Friends start getting a buzz. Then you start getting.
Were they screaming?
I don't know.
Or yelling?
Yeah, I was a hater.
I think he
How
was
would you
just
rate the
like-
cut? How would you rate the cut?
He said he was fine.
You look like you're
Really?
dying.
Yeah.
You did.
Well, so the thing is, like, when you get injured,
I
your
had-
body kicks into adrenaline mode, right? And so you don't feel the pain until the adrenaline kind of wears off.
Why do our bones
So-
have
It's like a
feeling?
twist though. It's long.
Well, that's a good question. Yeah, what is the purpose of pain receptors?
Yeah, it was like, why do our
What would happen
bones
if you
have
didn't have pain
receptors?
receptor? What would happen if you didn't have pain receptors?
Well, I mean, like, I understand, like, having it all on, like, our fingers and, like, our skin, but why does our bones need it?
Well, because if there's too much pressure on your bones, they need to tell you, like, hey, like, you got to take pressure off, or it's gonna break. Right. The purpose of pain receptors is to prevent tissue damage. Right. So, like, that's why people with leprosy, they don't feel any pain. But what ends up happening is they get a cut and they don't notice, and it gets infected. Right. Yeah. Do you finish?
Not yet.
Oh, okay. Okay.
Oh, is that why they say, like, if you have leprosy, you're not supposed to, like, go in the hot tub? 'Cause, like,
Yeah, because you won't.
feel like you're cooking
That's
or
right.
something.
Yeah, that's exactly right. Yeah. Plus, you'll probably spread the leprosy to other people if you're in. Yeah.
I like increase my outfit. Yeah, white tee, baggy pants. I'm aware of these baggy.
I think some bones have less pain receptors though. Like when you break your leg bones, it's like way more sore than like your arms or fingers.
What's the point of funny bone?
Your funny bone.
And why does it, like, hurt so much?
Your funny bone is actually not a bone. It's actually like it's like a gap in the bones where a lot of nerves are. It's a nerve
Oh, so,
plexus.
like, when you hit it, then it's, like, you really feel it?
Yeah, you really it like makes your, but it's not really a bone. But it's next to the funny bone. We'll talk about that today too. Yeah, it's next to the funny bone.
Do they call it the funny bone because it's funny when you hit your arm?
I don't know why they call it the funny bone. I mean, I don't know why they call the funny bone is called humerus, the humerus bone.
So
I don't know how it got its name. That's a good
it's
question.
funny when you hit your arm, everyone laughs at you.
Yeah.
Mr. Sherlock, what do you think about my haircut?
I like it. I like it. At Mililani, we would all do that like every year for soccer when we made playoffs. Yeah. Did you do it for sports?
Did you do it?
For sports, yeah. Yeah.
I did it for sports last year, but this year it's
Just for fun, just for style.
Funsies. No. It's like,
Did you lose a bet or something?
no, all the guys are getting like buzzing, bleach, and they're getting cheetah print.
For cross country?
No, you can't do cheetah print for HBA.
Yeah.
Yeah, but it's like all the surfer guys, and like they're all getting like buzz, bleach.
Is that the new trend or something, or like what? Just they just all want to do it.
We just all did it.
So are you gonna do the cheetah print for a little? No, you
I
cannot.
wouldn't be able to come to school.
You'd get choked the merits.
I get lit up by my-
So you're just gonna get as close as you can.
Yeah. Or like Sharpie and some.
Just for the weekends and wash it out from the ocean. Nice. That's pretty funny. Did you do it yourself, or you went to like a salon?
It's like me and like a couple guys like just started shaving our heads, and we just did bleach. And I still got a toner, but
Did you have to do it multiple times? Because it turns out orange first, right?
yeah. So
And it just looks super junk.
The second time it burned so bad. I like burned my scalp. Like, there's
Are
actually,
you
like-
serious?
Yeah, there's actually like
Ooh.
Scars kind of on my head 'cause it burned.
Did you put the hot cap on us, or what did you do to heat it?
Saran wrap on my head.
You put saran
It made
wrap?
it, like,
Are you serious?
more, like, stronger. Yeah. I couldn't even walk in the sun. It hurt.
Dude, that's crazy. That's crazy. Yeah.
Did it exactly right.
No. Yeah, I liked bleaching my hair, but yeah, you'd have to do it a couple. I like the white gold though.
The
Yeah.
platinum blonde.
Yeah, I like
That's
platinum
like
blonde.
really
Yeah.
hard to do for
I thought it was so
you.
cool. Yeah, like so cool. And
Did you get yours professionally done?
yeah, I went to the salon.
You have to do it like in multiple sessions, yeah.
No, they did it all at one time, but they had to do like the hot cap like 3 times.
So you bleached it 3 times?
Yeah,
and
I
then
bleached it 3
combed?
times.
Oh my gosh.
Yeah, it's not good for your hair, but
Yeah, I was like gonna say.
you
like,
don't. Yeah, I
I
haven't
think
done
you're
it
supposed
since.
to do it in multiple sessions to let your hair like relax.
Maybe.
But-
If you bleach it, your hair's just fried.
Yeah.
Yeah, it feels different.
Like, you
Yeah, if
should,
you feel
like,
Dylan's hair, it
give
feels
it, like, maybe
it
a week
feels
or
different
so
when
before
you wash your hair.
try it again.
Do you do it every year or just like one year?
I only made the team my senior year, so I only got to do it once. But like all my friends would do it every single year, and some people didn't do it well. So it's like orange, like a tamarind monkey. Tamarind monkey. Yeah, that's okay. Just report your score.
Okay.
Because that's just your starting point. We're compared out. So yeah, use that Google form. Yeah. Yep.
Wow.
Great. Okay, hey guys, let's go. So just record your top score for the day in the Google form, and thank you very much for doing that today. Okay, guys, we're gonna get started. I'm gonna try something different because my Loom is just not working. I don't know why. So I am on YouTube Live, recording it, and no one is in there. I sent the link to Caroline and the rest of them, but I guess they're just watching later. But we'll see how that works. Just trying new things. By the way, if you are following along through the PowerPoints while we're doing this, this session on the muscles and bones, it is actually not a Google slide, it's a PDF. So I just want to show you guys that just in case you're looking for it. If you go into Google Drive and you click on student PowerPoints, there's all the PowerPoints for this whole unit. But today's one is called a Discovery Station. It's a PDF. There's one for muscular, which we'll do after skeletal, after the bones. But we're going to be doing the Discovery Station skeletal system today. So just in case you're following along with that, that's where to find it. Again, my mission today in the next hour is to cover all the muscles and bones and try to review that with you. If we have time, go into the second PowerPoint for this unit, which is on the joints. So it'll be really, it'll blend very nicely with this lesson. Okay, but we're gonna jump into this. Actually, yeah, I'm gonna keep this light off so you can see it better, and I'm gonna zoom in since I know that it's a little bit hard to see. And we are gonna use Mr. Bones today.
His head's falling off.
Yeah, I gotta get a new skeleton.
His
I
skull cap.
gotta order another one. He's missing an arm because I guess he's a World War II vet and got blew off in the war. And yeah, his head kind of falls off a lot, so I'm not even gonna try to fix that. So yeah, this is Mr. Bones. He's gonna help us with our lesson for today, bones and muscles. So first thing first, and this is related to Unit 1. When we talk about the bones, there are two main categories of the skeleton. We have the axial skeleton and the appendicular skeleton. And lo and behold, it matches what we already learned in Unit 1. So axial refers to which part of the body? Okay, the axis. Yeah, central axis. So everything centrally would be considered the axial skeleton. On the test, I might ask you to do what I did on this slide to circle the axial skeleton. So notice it does not include any of the arms and muscles. It ends with the clavicles and also just the spinal cord. The hips are not part of the axial skeleton. Okay, so if you circle that on the test, I will have to mark you off. So just take note that the hips are part of the appendicular skeleton. Arms, shoulder blades are all axial skeleton. Appendicular skeleton. The clavicle, collarbone, though, sternum, ribs, spinal cord, head, that's all axial. Okay, so that's the first thing to note about this. Next, as we kind of move along, when we talk about your bones and muscles, there are 4 components that connect them together. There are 4 things that connect them together. Yeah, so yeah, there's a picture. There's like a blue picture. Yeah, this one. What page is that? 25. Yeah, go to page 25. That would be a good place to put all of this information. On page 25, we're gonna go through and label all of these bones. So yeah, just jot them down as we go through it. But before we jump into it, it's helpful to know how they're connected together. There are very different connective tissues that connect our bones together. So the first thing is cartilage, which you probably have heard of. A lot of our bones are connected to each other via cartilage. Okay, so for example, the ribs, they're kind of labeled with this like translucent epoxy, I think it's probably made out of, on our skeleton. So over here, there's some cartilage. In between your vertebrae, there are these discs that are made out of cartilage, right? And that's why if you get a slip disc, it's one of these things that kind of move out of place. You have some cartilage in your pubic symphysis that connects your hip, your pelvic bones. Okay, so cartilage is one thing that connects your bones. Okay, it's very flexible connective tissue. Flexible, but not too flexible. Okay, the next 2 are very much related. You got to keep them straight. And on the test, I'm going to ask you to distinguish between the 2. So the first one is ligaments. Okay, ligaments are also connective tissue, but they connect bone to bone. Okay, these are usually longer strands as opposed to cartilage are not really long strands. These are like long strings of connective tissue. So ligaments connect bone to bone. Okay, ligaments, bone to bone, right here. This blue. Can you guys see it back there? Riley, Cully. Do I have to zoom in more? I can zoom in a little bit more. Okay. So ligaments connect bone to bone. The most popular, most injured ligament is probably the ACL. ACL stands for anterior cruciate ligament. Okay, anterior because it's on the, which part of your knee? Front or back? Front. Okay, anterior. Cruciate. What does that sound like? Cruciate. Crucial. Crucifixion. It's in the shape of an X. Okay. Anterior cruciate ligament. And so ligament, what it does is it prevents your leg from swinging this way, like too far this way. If you didn't have your anterior cruciate ligament, your leg would swing this way. Okay. So yeah, anterior cruciate ligament. It is right behind your patella, and it's like in a little X. It's pretty cool. If you Google it, you'll see it. How do you tear it? Whenever you make like this kind of movement, like side to side movement, you're straining all of these ligaments. Your anterior cruciate ligament, medial, your MCL, medial cruciate ligament, and then your LCL, right? So a lot of people injure one of those 3 a lot because in sports, right, you're always kind of, making that kind of movement. So that's your ACL. Tendon, same thing. It's a string of connective tissue, dense connective tissue, but that connects bone to muscle. That's the difference. Ligament, bone to bone. Tendons are bone to muscle. The most popular tendon, the most injured tendon is probably your Achilles tendon. You might have heard of Achilles tendon. Where is that located? Okay, yeah, if you feel your ankle right now, there's this like hard part on the back of your, like right above your heel bone, right? You guys all feel that hard. There's like a hard, I don't know what it feels like. It feels like a big rope on the back of your heel. That is your Achilles tendon. It gets torn or injured a lot. But your Achilles tendon connects your heel bone, what's called your calcaneus. So this bone right here, it connects this bone to your calf muscle. Anyone know what your calf muscle is called? Gastrocnemius, yeah, or gastrocnemius. Okay, gastrocnemius. We'll get to that later, yeah. Okay, gastrocnemius. Yeah, nice. Yeah, physical therapy represent. What? How do you? Yeah, so good. Your Achilles tendon, right? Since it connects to your calf muscle. Whenever you go up on your tippy toes when you jump, right? your calf muscle is flexing and it's pulling on your calcaneus. And so just at certain times, if you don't stretch it good or under certain circumstances, you could tear it or completely or pull it or completely tear it. Yeah. So if you tear your Achilles tendon, you cannot jump at all. Yeah, it's really weird. But anyways, yeah. Anyone tear that before? Achilles tendon? Okay, good. ACL? Hopefully not. It's like a really unfortunate. Hopefully you guys don't do that. Okay, so try that with your neighbor. Axial versus appendicular skeleton. What are the things that connect your bones together? Ligaments, tendons, and cartilage. Go. The question is, where is his arm? About 30 more seconds.
I want to know who like teared his arm off when like took it.
Yeah, something happened over here.
It's like sitting in a closet somewhere.
Okay, finish up in 5, 4, 3, 2, and 1. We will talk about joints more later when we talk about the different kinds of joints. But just to put it out there so we can kind of build off of this, a joint is whenever there's two or more bones connecting together. Okay, they can connect via cartilage or via tendon or via ligament, but it's whenever there's two or more bones connecting together. Okay, but we'll come back to that later. All right, bones of the upper limb. Here we go. This is where we got to start memorizing. All right, so we're going to do the arm first. Mr. Bones, one arm. Okay, this arm, upper arm that contains your bicep and tricep, this bone is known as the humerus. Okay, and that's why when you hit your elbow, okay, when you hit your elbow down here, you hit your funny bone, which is not really a bone. It's actually a gap between your humerus and other bones, but and that's where a lot of nerves are. Okay, but hopefully that helps you to remember it better. Okay, humerus, funny bone, haha. Okay, upper arm. All right. The next one. All right, over here in your forearm, you have two bones. Okay, two bones, and one of them is the radius, one of them is the ulna. And so, how do you tell which one is which? Okay, here's how you tell. So I'm gonna point out your own body. Okay, so if you look at your arm, okay, notice you have a bump, right? There's there should be a round circle, a round bump on the pinky side of your forearm, right? You guys feel it? Okay, that's the ulna. Okay, what is that? Ulna. Okay, the ulna is always next to the pinky. Okay, so if you're right, anatomical position, ulna is on the inside of your body. Okay, but sometimes there's pictures of just the arm, so you gotta look for where the pinky is. Okay, ulna. Radius is the other one. It's more flat. It's on your pinky side every time. Okay, radius and ulna. All right, guys got that so far? Okay, so that's not too bad. Humerus, radius, ulna. Okay, let's look at the hand. Okay, if we look at your hand, maybe I'll bring it over here. Okay, your hand is a really, really intricate piece of technology. At the forefront of your hand, at the beginning of your hand, you have these things called your carpals. That's why if you do a lot of typing or play piano, sometimes you get carpal tunnel syndrome. Okay, what carpal tunnel syndrome is, and usually it happens in more females. The wrist is so small that sometimes as the muscles get bigger in your wrist, it squeezes on what's called the medial tunnel, which is nerves that run to provide your hand with communication. And when you squeeze that, it makes you have pain. So a lot of times the treatment for carpal tunnel is they cut that ring that holds those nerves together and then it releases that pressure. But anyways, carpals, metacarpals, phalanges. Okay, you guys see the progression? Because this is gonna happen again on your feet. You have carpals, metacarpals, that's in your hand, metacarpals, and your fingers are phalanges. Okay, fingers are phalanges. Yeah, so try to spell that. Carpals, metacarpals, phalanges. Carpals, metacarpals, and phalanges. Carpals, wrist, metacarpals, hand, and phalanges are your finger bones. You have 14 of your finger bones. Okay, review that with your neighbor. See if you can get the muscle bones of the arm.
Okay, so humerus, ulna, right here, radius,
Okay, finish up in 5, 4, 3, 2, and 1. Okay, next. Okay, pectoral girdle is next. Okay, there's only 2 main bones here. Okay, so when we talk about the pectoral girdle, we're talking pectoral is like your pecs, okay, chest. Okay, pectoral girdle versus pelvic girdle. Okay, there's 2 girdles in your body that kind of are like a basket. Yeah, pectoral girdle is in charge of guarding your heart and your lungs and providing structure for your arms. Okay, pectoral girdle though, the bones that are really in charge, we have your clavicle, also known as your collarbone. This bone also gets broken like super easily. If you just fall down, it can break, and it's not that painful usually. Okay, whenever you brace yourself, you're putting some strain on the clavicle. So clavicle, and then on the back, we have the scapula. Okay, scapula. What does that sound like? Scapula. Scalpel, that's why we call this your shoulder blade. Shoulder blade scalpel. Does that kind of make sense? That's how I remember it. Okay. Scapula is your shoulder blade. Okay, on the test, you need to put scapula. Don't put shoulder blade. Okay, scapula, clavicle. Those are your pectoral girdle bones. Okay. The thing about the pectoral girdle is it is actually not as strong as a pelvic girdle. Pelvic girdle is way stronger, but pelvic girdle is more mobile. Okay, that's why you can do a lot more things with your arm. You can go full circle with your arm. I guess you can try to do that with your leg, but your pectoral girdle is way more flexible, way more mobile, and it trades that for a little less stability. Pelvic girdle, very stable, but not as mobile as the top. Does that kind of make sense? Okay. Try that with your neighbor, pectoral girdle versus pelvic girdle, and the 2 bones of the pectoral girdle.
The back this area. I'm pretty sure there's a name for those bones.
Which one?
There's a name for those bones.
There probably is, yeah. Yeah, there probably is. Okay, moving on in 5, 4, 3, 2, and 1. Thank you, Jason. Nice. Yeah, pelvic is more stable but less mobile. Pectoral girdle, more mobile but not as stable. Yeah. Okay. And it makes sense, right? Your pelvic girdle is sustaining your weight the whole day, right? No one's walking on their hands the whole day. So, although there's some people, yeah, who walk on their hands if they don't have. Never mind. Lower limbs. you're gonna see that there is similarities between the upper limbs. So the longest bone in your body is the femur. Okay, that is your thigh bone. That is the longest bone in your body. Okay, we have your femur. Your kneecap is called the patella. Kneecap is called the patella. And then just like your forearm, you have two bones in the lower leg, the tibia and the fibula. Okay, the tibia is your shin. Okay, the tibia is your shin. The fibula, you can't actually feel very much except for this little bump that's kind of like the ulna on the side of your knee. I don't know, some of you might feel that bump. You guys feel that bump? That is the fibula. Okay, the fibula kind of sticks out right there. Fibula, it just supports your tibia. Okay, so femur, patella, you got your tibia, which is your shin, fibula, which is next to it, and then the foot. Okay, the foot, just like your wrist. What were your wrist bones called? Carpals. Your ankle bones are called tarsals. They're kind of like carpals, but tarsals. Okay, guess what your foot bones are called? Metatarsals. And then your toes are, what are your fingers called? Phalanges. Your toes are also phalanges. Okay, so that's kind of nice, right? There's parallel. Okay, your toes are phalanges. You also have 14 phalanges on your foot, just like your hand.
What?
Okay. Yeah, every joint is a separate bone on your finger. So like your pointer finger has 3 phalanges right there. Okay. So you have a ton of different bones inside of your hand. Okay, the one thing that's a little bit different from your foot is you have this mega ankle bone on the back side of your foot, your heel bone, okay, that connects your Achilles tendon. That is called the calcaneus. Okay, calcaneus. Sorry, it's like light colored blue. Can you guys see it? Calcaneus. Okay, calcaneus. I do not have a way to remember that. Okay, calcaneus. Callus. Hey, I like it. Callus on your ankle. I guess that's where you a lot of times get a callus on their heel. Okay, calcaneus. Okay, try that with your neighbor. Leg bones, all of them. Name of go.
This is.
Okay, and if you finish, try to review the other bones as well.
What was that callus you talked about?
Calcaneus is your heel bone. Calcaneus. Jake kind of connected it to callus. Kind of sounds like callus. Calcaneus. So I don't know. That might be a weird.
Yeah. And then the metatarsal and then the phalanges. Oh, I forgot my patella.
Okay, finish up in 5, 4, 3, 2, and 1. Okay, next. Moving on. So moving on to actually we're gonna come back to the pelvic girdle. I want to finish up above rib cage, real quick. Okay, rib cage, your pectoral girdle. All right. You have 2 bones in your rib cage. The very center bone, and this is nice because you already know this body. What is the body region of right here? Remember? What? Sternal area. This is your sternum. Okay, sternum, also known as the breastbone. Okay, but this is your sternum. Okay, because this is the sternal area. Okay, a lot of the body regions are named after the bone that is next to. Okay, sternum. Okay, and then next are the ribs. You have 12 pairs of ribs, so 24 ribs total. 12 ribs, and there's 3 categories of ribs, depending upon how they're connected to the sternum. Okay, there's 3 different categories, and it's pretty easy. Okay, we have first of all the true ribs. Okay, true ribs are directly connected to the sternum. So all these ones that have a direct connection, a one-to-one connection with the sternum, those are all true ribs. But if you notice these ribs down here, they're all connected together first before connecting to the sternum. You guys see that? So these are called false ribs. Okay, the bottom 1, 2, 3, 4, 5. The bottom 5 are false ribs. So the top half, top 1, 2, 3, 4, 5. Oh, good. It's 5 and 5. 5 and 5. Top 5 are true ribs. The next 5 are false ribs. And then the last 2 are floating ribs. You'll see why they're floating. Okay, but true, false, floating ribs. Not sure if you can see it. You can see it more if I turn around. See these ribs kind of just hanging out right here? They're not connected at all to the sternum. They're called floating ribs. They're just floating there. You guys all see that? These floating ribs at the very bottom. They're not connected to the sternum at all. You can kind of feel them in your lower back. They're kind of just sticking out right there. Okay, floating ribs. All right, try that with your neighbor. What are the ribs, sternum, different kinds of ribs? Go.
False.
5 true ribs, 5 false ribs.
Yeah, they're floating. Not even touching the sternum.
True, connected to the sternum. False,
So
not connected.
true.
Floating. Femur.
Yay.
Patella. Patella.
Okay, finish up in 5, 4, 3, 2, and 1. Okay, back to pelvic girdle. So again, pelvic girdle is stronger. It's designed to bear more weight. And this is actually what separates us from the monkeys, because monkeys walk on all fours. Their pelvic girdle is not designed for strength. Both of their girdles are designed for mobility. So our pectoral pelvic girdle is a lot stronger than theirs, but there's not as much mobility. Okay, so there's a bunch of small different parts to your hip bones. Okay, the ones that you guys really have to actually, yeah, we should just talk about do all of them because I think they're on the GIMP kit. Okay, we have, what is the, do you guys remember like body regions? What was the part right here called? Okay, your sacral area, right? Sacral. This is your sacrum bone. It's called that because you have a sacrum bone. Sacrum. Okay, sacrum. Your tailbone is called the coccyx. I don't have it up there. Maybe it's a little bit lower. Nope, I don't have coccyx. Okay.
It's there, it's just really small.
Yeah, it's like it's. Yeah,
It's on the spine.
Yeah, it's also on the spine page, but
It's this like
Okay.
this.
okay,
Is
coccyx.
this the tailbone? Is
Okay, that is your tailbone. Okay, coccyx. Okay, your hip bones themselves, they are called ilium. Okay, ilium. I don't know. Can you guys see this yellow? Okay, let me jot that too.
So the sacrum's in the back.
Yeah, sacrum is in the back. This part right here. Okay. Sacrum, ilium. Okay. This bottom rim part of your pelvic bone is called the ischium or ischium, or it's called ischium before. And then we have the pubis. Okay, pubis in the pubic region. Okay, pubis is at light blue, ischium is at light green. Okay. This is spelled ischium. Okay, ischium and pubis. Okay.
like this one, the top bone. The top bone is the pubis.
Right.
So this is the-
Where's the ilium?
Ilium is right here. These big like
Is
hip bones. You can feel the top of your ilium. Hip bone. That's ilium. Ilium, sacrum, coccyx, pubis, and ischium. The ischium and ilium kind of get confused a lot, so be careful of that. Okay, here's the thing that's super cool about bones. Well, sort of cool about bones. When forensic scientists find a dead body, a lot of times they can tell a lot just by looking at the bones. Even if it's just a singular bone that got separated from the rest of the skeleton, like just a femur. We can tell your height. Sometimes we can tell even your ethnicity. Which is crazy. Based upon your ethnicity, your bone size and density are different. We'll just leave it at that. Your bone size and density are different. We can tell your gender based upon your hip bones. And so here, compare. This is a male pelvis. This is a female's pelvis. What do you notice? What are the differences? Male, female. What is wider? Okay, you see this? Pubic arch is wider in females. It is easier for them to do the splits. Okay, it is designed for childbirth. Okay, male. Okay, acute angle right here. Acute angle, almost an obtuse angle here. Okay, that's one difference. Another difference. Look at the hole that it makes. Okay, what do you tell about the difference about this? Male, female. Okay, yeah, female is a lot larger, a lot more circular. The male is a little bit more. I mean, it's not even a circle, right? It's kind of like a heart shape. Okay, but the female is a lot more circular. Again, why is it like this? Okay, childbearing. Yeah, it's designed for that. Okay, childbearing. All right. And that is also part of the outrage of allowing transgender athletes to participate in female sports because bone density is different. Testosterone develops bones a certain way. Estrogen develops bones a different way. So there is a difference between male and female males and females. Okay, review that with your neighbor. Pelvis, female versus male pelvises. Go.
What is the curvature of your spine supposed to be?
It's supposed to be like S.
Yeah, like how much is it supposed to be?
There's probably a number. I don't know.
Because I know mine is like 30 something, which I have
Degrees?
scoliosis. Yeah. So mine is like not like minor, but not like major. So they're just like, oh,
Yeah.
whatever.
I mean, most people have a little bit of scoliosis. No one's spine is straight.
Mine's is kind of bad.
Here's a-
Like,
Okay, finish up in 5, 4, 3, 2, and 1. All right, so moving on. We have a couple more. So hang in there. Okay, the back, the spine. The spine is important because it houses your spinal cord, which connects your brain to the rest of your body, communicates. If you break your back bad enough, you will be paralyzed from that point on, right? Some people might have heard of Johnny Erickson Tada. She dove into the water, hit her head, compressed her spine. She's paralyzed from, I think, the neck down. So depending on where you break your back, you could be paralyzed from that point on. But there are your back vertebrae are labeled with numbers. So I want you to count them. I want you to feel your neck, and you should be able to feel the first bump on your neck. Do you guys feel that? Okay. That bump is actually not C1 because C1 goes kind of into your body. I believe if you're feeling that first bump is C3. Okay, that bump is C3. And then as you go down, you can count C4, C5, C6, and then C7. Okay. And actually I miscounted. Some of you guys might be a little different too. One of them should be sticking out a lot more than the others. You guys feel that? Okay. The one that sticks out the most should be C7, I believe. Okay. Ask your chiropractor about that though. I think it's C7. Well, if you break any of them bad enough and it severs your spinal cord, then you're paralyzed. Yeah. Okay. So C, that stands for cervical. Okay. Cervical is your neck, right? Cervical area is your neck. So you have your cervical vertebrae. After that, okay. After that, we have vertebrae that are kind of parallel to the chest region. That's your thoracic vertebrae. You have 12 of those, T whatever. So that's why if you're to break or fracture one of your vertebrae, they say, oh, he broke T6. Okay, or compression. Usually it's a compression fracture where your spine compresses on itself. Okay, thoracic. Okay, what is this body region? Lumbar. So these are your lumbar vertebrae. Okay, lumbar vertebrae. Lumbar vertebrae. And then lastly, again, it connects to your tailbone, sacral, and your coccyx. Okay, sacrococcyx. Okay, that's your vertebrae. I could test you on like how many of each, but for this test, I'm not. Okay, but just a heads up. Again, we could always go deeper, and maybe we'll go deeper later on in third quarter. But for now, you just have to know these regions. Okay, cervical vertebrae, thoracic, lumbar, sacral. You got to know them in order. Okay, on the test, I'm going to say, what is the order of your vertebrae? Cervical, thoracic, lumbar, sacral, coccyx. Okay, turn to your neighbor, try that with them. Go. Thoracic. Yeah, thoracic.
I know some of this because I have pain in those areas.
Yeah.
Cervical,
Cervical, thoracic,
How do you know when you tear your
lumbar,
When you tear your MCL,
sacred,
well, number one, it hurts on the medial side.
Toxic.
Toxic.
Especially when you
I didn't
move
copy
it.
that.
You're stretching it. Is it sore?
Oh no, I'm
Okay,
just
cervical, clavicle,
I just see like some people because my mom goes to physical.
thoracic,
They're like saying, oh yeah,
short ribs, false ribs,
MCL, ACL, and then LCL.
So like one way to fix it is to like
thoracic,
If it's a complete tear, surgery. If it's a strain or a tear, it'll heal on its own. So if you do it, okay, finish up in 5, 4, 3, 2, and 1. Okay, lastly, the skull. Okay, I am not gonna test you on this, but I want to just go over it because the GIM kit. Okay, GIM kit real quick, and actually some of these bones will be helpful for our next chapter when we talk about the brain. Okay, so you gotta know at least these 4. Okay, know these big 4. Okay. The front bone on your forehead, that is known as your frontal bone. Okay, frontal bone. Okay, frontal bone. On the sides of your head, okay, sides of your head, we have your parietal bone. Can you guys see that? Parietal bone. Okay, that is also parietal lobe. Here, let me zoom in. Okay, you have your parietal bone. Okay. On your temple or the side of your head, right in front of your ear, is your temporal bone. Okay, temporal bone, your temporal bone. And then on the back of your head, where that bump is I showed you yesterday, that is known as your occipital bone. Sorry, I went through that fast. Oh, you can't, I don't even have the occipital bone on here. Is it on the bottom? Oh yeah, there it is. Occipital bone. Thank you. Okay, those are you got to know those bones because those are also the parts of your brain that we'll cover next chapter. The other ones, not so important for now. I mean, of course, later on it's important, but okay. All right, just to go over briefly, really fast. some of the other bones. Okay, in front of the temporal bone. So like right here, you might even feel like a hard edge where your eyeball is. Okay, that is called the sphenoid. Okay, sphenoid bone. Okay, sphenoid, of course, this is called your nasal bone. Okay, nasal bone, and the tip of your nose is cartilage, but the top part here is your nasal bone. Okay, I've been told if you hit that hard enough, so if you like self-defense, if you hit this straight on like hard enough, it'll pierce through the brain and you'll kill somebody. I don't know. Yeah. So yeah, nasal bone. Okay. What else? Okay. On the eye orbit and your cheekbone. Okay, your cheekbone is known as your zygomatic bone. That's kind of cool name. Zygomatic bone is right next to the sphenoid bone. Okay. Oh, and then your mouth. Yeah, you should probably know your mouth. Your lower jaw is called your mandible. Okay, mandible. And your top is called your maxillary. Maxillary. Okay. That's why, like, you know, like somebody who does braces, what are they called? Anyone know? Okay. Or yeah, orthodontist. Sometimes they call them like a maxillofacial doctor or whatever. Where's the sphenoid? Sphenoid is pink. Yeah. Yeah, kind of looks like Europe, like all these different parts of the bone. Okay. Also, just to point this out real quick, there's a really cool bone right next to your bone inside of your eye. You can't really feel it. It's called your lacrimal bone and your ethmoid bone. That's where your tears come out. Okay, when you cry, there's a little hole in your lacrimal bone that leaks out the tears into your eyeball. Okay, but anyways, yeah. Again, those are not on your tests, but it's really helpful to know at least the top part of your bone for later. Okay.
Your eyes like suddenly produce tears when you're not crying.
Oh, it's a reflex. Yeah. So let's say you slam your finger really hard, and your eyes start tearing up, right? Or you pluck. Actually, here's a better one. You pluck your nose hair. You guys done that? Oh, and it's like you start tearing up. It's a reflex. So it's just an automatic thing your body does as a defensive mechanism. Yeah. So, but here's another cool thing. So many cool things. You know when you cry, right? When you cry really hard, there's a hole inside of your brain. Not your brain. You're inside of your. Oh yeah, here you can see it on this picture. There's a hole. It goes from your eye into your nasal cavity. Okay. And it's actually a drainage for your tears. So when you cry, what happens almost immediately after? Your nose starts getting sniffly, right? And it's because your tears are leaking into your nasal cavity. Yeah, so pretty cool. Anyways, okay, before we move on to muscles, with your neighbor, try to review all the different bones, starting with your arm, your rib cage, your body, all of them. Yeah, stand up and do it. Stand up. So you start with your
And then cervical, thoracic, lumbar, sacral, and frontal, the one in the back.
Get radius. Yeah.
Oh yeah.
you go into red, oh, we have your true.
I think visual is smaller. Yeah.
Okay, finish up in 5, 4, 3, 2, and 1. Okay, take a seat. We're gonna try to do muscles. Finish that out. Okay, muscles. Traditionally, muscles are harder to remember because they're all Latin names, and sometimes they have like two names. Like pectoralis major, there's like two names for like one muscle. So it is difficult, but here's what you want to keep in mind, and this will also help you to memorize it better. There's a reason why they're named this. Like the bones, not so much. There probably is a reason, but we don't really, know it. But these muscles, they're either named on their location. Like the temporalis muscle is in the temporal region, right? So that's why a lot of these muscles are named that. Some of them are shaped. Like the deltoid muscle is like a triangle. That's the official name for triangle, deltoid. Okay. Or a trapezius is a trapezoid, kind of. Okay. Some of them are on muscle size. So like gluteus maximus versus gluteus minimus. Okay. One is bigger, one is smaller. And so on and so forth. Okay. So a lot of them, they're named that way for a reason. Hopefully that helps you to remember it better. Okay. So let's go over upper body muscles. And yeah, you guys, I already labeled them for you because it takes forever to write down their names. So just highlight the ones that we go over. You have like 600 muscles in your body. So it is impossible, for our case, we're not going to memorize all 600. We'll memorize about 30, I think. Okay. And when we model them on the mannequin, we'll go over smaller ones. Okay. Yeah, what page is that? Page 38. Yeah, we're on page 38. Okay, here we go. Here are the upper body muscles. Okay, and hopefully you know a bunch of these already. Okay, so this one right here, chest, is called your pectoralis major. Okay, that's the one you have to know for the test. There is also a pectoralis minor. There's also a pectoralis medius, I think, medial head of the pectoralis minor. Okay, but you got to know pectoralis major. It is a main pec muscle. Okay, deltoid, go like this, stretch your deltoid. Deltoid, stretch your deltoid. Okay, shoulder. That is the main muscle of your shoulder. Of course, there's a whole bunch of muscles in your shoulder that all contribute to what we call the rotator cuff. But we'll take a look at that again later. You got to know the major muscles, deltoid. Okay, your abs are called rectus abdominis. Okay, rectus abdominis. Okay, rectus abdominis. Okay, that is your abs. And then on the sides of your abs, okay, when you do a twisting motion, okay, those are called your external obliques. You also have internal obliques, but you got to know the external obliques. Okay, external obliques. Okay, external obliques. Same thing with rectus abdominis. There are some muscles underneath that, but we're just doing the main ones. Okay, last one for the upper body. Okay, and this one you can't really see very well. It is inside your rib cage, but it helps you to breathe. This is called your diaphragm. Okay, really important for band. Those of you in band. Okay, diaphragm is very important. Okay, diaphragm. It's spelled diaphragm, but diaphragm. That is not on your paper, so just add it to your, like, on the margin. Diaphragm is important for breathing, right? Inspiration, expiration is important for breathing. You didn't have your diaphragm, you wouldn't be able to breathe. Okay, it changes the pressure gradient inside of your chest cavity. Okay. All right, try that with your neighbor. Muscles of the upper body, go. Rectus abdominis.
I know this abdominis.
Okay, well, all of those areas hurt right now. I lift one, and I can like go on.
Oh, I do remember deltoid.
Deltoid. And then what is it? Pectoralis. Pectoralis.
Pectoralis. It's like a spell. Pectoralis major. Okay, finish up in 5, 4, 3, 2, and 1. Okay, moving on. Okay, here we go. Arm muscles. Again, we are going to memorize the basics and build off of it later on, probably quarter 2. Okay, you got to know this main one that is like the most famous muscle probably of all time. That's your biceps, but you actually have 2 biceps. So this is your biceps brachii because it's in the which region? Brachial region, biceps brachii. You also have biceps femoris, which is next to your femur. Okay, it's a fancy name for your hamstrings. Okay, biceps femoris, but biceps brachii. Okay, opposing that. Okay, when you stretch like this, that's your triceps brachii. You have your biceps brachii and your triceps brachii. Okay, triceps and biceps brachii. Yeah, it's on the posterior. Triceps is on the right picture. Should be on the right picture. Okay. Okay, biceps and triceps brachii. All right. Yeah, it's on the right picture. Okay. These other small muscles, if you clench your fists, you might be able to see some of your other forearm muscles. Okay. We're not going to cover those. I'm not going to test you on those, but just know there's a whole bunch of them. Okay, there's flexors and there's extensors, but we'll talk about that later. Okay, those are the only ones you got to know: deltoid, triceps, biceps. Yeah. Okay. Since those were only 3, we're gonna go over these ones as well. Okay. Your thigh muscle. Okay, has specific names for it as well. We're gonna know it for this test as quads or quadriceps. Okay, quadriceps. Okay, so do your thigh. Your thigh will say like vastus lateralis, vastus medialis. Those are the official names for it, but just know it as quadriceps. Okay, your thigh is your quads, your quadriceps. Quad means 4. Yeah, so there's 4 muscles that all contribute to the quadriceps. Okay, next one. Yeah, if you see, there's like a thin muscle. It is the longest muscle in your body. Okay, it starts off on your hip and it ends on the backside of your knee. That is the longest muscle. It is a pretty cool name, sartorius. Okay, can you guys say sartorius? Okay, sartorius. So that's why it's on both pictures. It wraps around the back of your knee. Okay, sartorius muscle. Okay, your groin muscles. Okay, are called adductor muscles. Again, I think it's labeled as specific stuff. It's labeled as your iliacus and your adductor magnus. Okay, just know it. You just have to know it as your abductors. Your groin is your adductors. Okay. What else is important? Okay, your calf muscle is your gastrocnemius. Okay, gastrocnemius, calf muscle. Okay, if you raise your toe up, okay, point your toe up and feel your shin, there should be a nice muscle that's right next to your shin. That's your tibialis because it's named after the tibia, tibialis anterior. Okay, tibialis anterior. Quadriceps are like, it's like vastus blah blah blah, vastus lateralis, vastus medialis. Those are all your quadriceps. Okay, there should be 4 of them. Okay, last one. Okay, the back of your leg that oppose your quadriceps. Okay, we're gonna know it as your hamstrings. Okay, hamstrings for now. We'll go into the specifics later. But as your hamstring, it is made up of 3 muscles: biceps femoris, okay, which we talked about 2 different biceps already, and then semitendinosus, semimembranosus. Okay, but you just label all 3 of those as your hamstrings. Okay, back of your leg is hamstrings. Biceps femoris, semimembranosus, and semitendinosus. It's on the back side of your leg. Okay, those are your hamstrings. Okay, just know them as your hamstrings. Okay, try that with your neighbor. What are the muscles of your leg and your arm?
Excess abdominis, yeah, and then the external.
I only remember quads and then your tibias.
Deltoids. The last one is the.
Okay, finish up in 5, 4, 3, 2, 1. Okay, last slide for today. Back and butt muscles. Okay, the most important. Actually, there's two of them. There's two wraps on your back. Okay, the upper triangle, and it goes all the way to your neck. That is like a nice muscle to massage. That is your trapezius muscle. Okay, trapezius. Right here, okay, so when you do pull-ups or you do the, what is that called, the press, something press, lat press, right? That's your latissimus dorsi. That's what's called lats, okay, latissimus dorsi, okay? Your spine has muscles that help you do that. Stand up straight. That's called your erector spinae, right? Erector is like straightening, right? Erector spinae. Your butt muscle, you guys all should know already. Gluteus maximus. The upper part of it is your gluteus medius. That's not so important though. Just know gluteus maximus. It's on the back side of your butt. Yeah, there. Medius is like on the top border. Oh yeah, you have it. Yeah, medius is like the top part of your butt. Okay. All right. We did it, guys. We didn't get to review that, but good job. We made it through bones and muscles. Good job. Have a great day.
I'm not gonna remember.
We'll see you guys on Wednesday.
I feel like that would be easy to remember. Where is that?
Because it like makes sense.
I think that most of the